We see GI stuff all the time in kids. It's going to happen when you have kids that are touching everything and putting their hands in their mouth, not necessarily washing their hands. So we're going to see lots of GI stuff: abdominal pain, vomiting, diarrhea. When do you need to go to the doctor? Well, let's be honest. If you have a GI bug and you have vomiting, diarrhea, I can't do anything for you until you get dehydrated. So unless you're just needing to go see us because you need a school note to get you forgiven for missing school, there's not a lot of reasons to come see us. You know, we're going to treat symptomatically. If you have vomiting, give your belly some rest. Make sure you're not pushing fluids too fast because that can just make you keep vomiting. Give your belly a little bit of rest. Don't push anything until you haven't vomited for about 2 hours, and then go with small things. Have some sugar and salt. I usually like G2 Gatorade or Powerade in really small sips, and then advance that. Get where you haven't vomited for at least 6 hours before you start any solid foods, and again, kind of go bland and advance as tolerated. If you have vomiting and diarrhea, you have a virus. It's going to run its course. It can last a while, and its normal course is you're going to start vomiting, and then somewhere in the middle of your vomiting, you're going to start having diarrhea. Vomiting usually lasts anywhere from a couple hours to maybe about 18. Diarrhea can last for 3 to 5 days. So when do you need to come see your pediatrician? Well, one, if you have any signs of dehydration, your kid's getting lethargic, they're just laying around. You start to see their eyes sink in. You start to see their lips getting all puckered, kind of looking like a raisin. The inside of their mouth looks dry. That could be signs of dehydration. One of the things I like to teach my parents is what's called cap refill. Now, if you notice on your nail, there's a pink part. If you push down on that pink part of the nail, it will turn white. When you let go, after just a little bit, it'll turn pink again. So what I tell people is, push down till it's white. Let go. Count 1001, 1002, 1003. That pink should return within 2 seconds. If it's taking 3, there's a good chance you need an IV. That's something you need to either go see your pediatrician, if they can do IV fluids there, or even maybe go to the emergency room. With diarrhea, we worry if you ever see any blood. If you see blood in your diarrhea, then we worry that there may be something bigger going on, like a bacterial infection like Salmonella, Shigella, hemorrhagic E. coli. These things can be serious and can cause lots of problems. The other thing is we kind of worry if you've had diarrhea that's lasted longer than 5 days for the same reason. So typically we're going to do some stool studies and stool cultures. So the big things with vomiting and diarrhea is, do you look dehydrated? Do you need IV fluids? Or have you had a prolonged illness that's lasted too long? Now let's just say that you just have vomiting and no diarrhea. Well, that can be a sign of something else. So if you've had vomiting that's lasted longer than 18 hours and no diarrhea, then we have to think of things like strep throat or diabetes. And so that should trigger you to go, hey, we probably need to go get seen. So those are the things we worry about with vomiting, diarrhea that actually need to be seen. Now you may be finding that you have to come see us for some notes to get back into daycare or for school, but for actual things that a pediatrician is going to help you, dehydration, worrying about diabetes or possibly a urinary tract infection, or prolonged diarrhea is going to be the reasons you need to see us.